Hi, thank you all for joining us today for what I'm sure is going to be a great conversation about giving people direct, unconditional cash and what it can do for income security in the United States. I'm Greg Kaufmann. I'm a longtime poverty journalist with The Nation and current contributing writer there. I'm also currently working with the Southern Economic Advancement Project, founded by leader Stacey Abrams, on their South Strong campaign, which is 195 Southern organizations, grassroots leaders, and scholars who are working for an equitable post-pandemic South. And I hope you'll check us out at southstrong.org. Now, I know you all have Zoom fatigue like everybody else in the country, but I have the antidote for you because I have three awesome panelists with us today. They know their stuff. They're energetic and they're going to wake you up. So get excited. I'm going to introduce each of them to you now. We have with us Dr. Aisha Nyandoro. Hi, Aisha. It's great to see you. She's the I know Aisha previously, full disclosure, but she's the chief executive officer of Springboard to Opportunities, where she leads efforts to provide programs and services to families living in federally subsidized housing. In 2018, Springboard launched their fantastic Magnolia Mothers Trust project, which provided $1,000 a month for a year to 20 African-American mothers living in poverty in Jackson, Mississippi. In March, that program was expanded to, I believe, 110 moms in Jackson. And I just want to welcome you, Aisha. Thanks for coming.
Thanks for having me.
Yeah, and Hope Huskey is an enrolled member of the Eastern Band of Cherokee Indians. She's the associate director of the tribe's Sequoyah Fund, where she manages non-lending programs involving both youth entrepreneurship education and also savings. She also helps people improve their credit scores and create and manage budgets, gain a better understanding of personal finance, including how they can manage their per capita distributions from the tribe's casino profits. Welcome, Hope.
Thank you. It's great to be here.
Great to have you. And we have finally Dr. Iona Marinescu, who is an assistant professor at the University of Pennsylvania School of Social Policy and Practice. She's also a faculty research fellow at the National Bureau of Economic Research. She studies the labor market to understand and craft policies that can enhance employment, productivity, and economic security. Her research expertise includes universal basic income, unemployment insurance, the minimum wage, employment contracts, and more. Welcome, Professor.
I'm happy to be here.
So a reminder to our audience, please submit questions throughout our conversation in the little Zoom Q&A function at the bottom of your screens. Should be, I believe, at the bottom of your screens. And let us get into this. A lot of people have been talking about direct cash assistance the last few years. We have discussion of a universal basic income during the pandemic. Last year, we heard more about that. We've seen great guaranteed income pilots, such as the Magnolia Mothers Trust. We had a great pilot in Stockton, led by former Mayor Michael Tubbs. We've had the formation of the Mayors for Guaranteed Income. So we've seen a lot of interest. And I want to start with you, Iona. I want to think about some of the resistance we hear about the idea of giving people direct cash, direct unconditional cash. Often people say, well, is it going to be a disincentive to work? Or also they say, oh, are people really going to spend the money the way they should? These kinds of things. But the research, your research, reveals a very different picture from what people who raise those kinds of issues say. Can you describe the kind of impacts you've seen in terms of labor participation and spending and other impacts that your research shows?
Right. So, when you think about basic economic theory, you might think that, if people receive this income for nothing, they don't need to work as urgently, and therefore that could reduce their willingness to work. And so then, you can look at the evidence. Obviously, the world is more complicated, so it's always good to look at the evidence. And so we've been looking with my co-author, Damon Jones, at Alaska, which has a form of universal basic income over there, where people receive every year between $1,000 and $2,000, including kids. So what we found is that this program had no effect on employment. So employment in Alaska after this program was introduced, and it's been going on, I want to make it clear for everybody, for more than 30 years. So this is very much a permanent program, had no effect on employment. And then, we showed that part of what's going on here is that while perhaps this has led to some people wanting to work less, at the same time, businesses received more customers who were spending money in local restaurants and shops, and that might have stimulated employment creation. And so these two forces, on the one hand, maybe a lower willingness to work from some, but then more employment creation, basically cancel out, and we see no employment effect. And then I've been writing a whole review of the literature, just looking at many other such experiments, and the results are quite consistent in showing small or no impacts on work, including, I will say, among the Eastern Band of Cherokees, and we have Hope with us here. There's been great research on that, and their casino payments don't have any impact on work either. So that's, so again, if we look at this literature, there is, in some cases, some negative impact on work, but it's quite small. And in many cases, you don't see any impact at all. And then the other concern that people have oftentimes is, hey, you give money to people, but do we really trust them to spend it well? So there again, studies have looked at this issue, and basically the upshot is that there is no increase in spending on drugs and alcohol. And again, in part based on the experience of the Eastern Band of Cherokees, in fact, there was a reduction in drug and alcohol problems, especially among youth. So, the evidence is that not only there is no negative effect, but in some cases, this extra cash could facilitate people addressing their mental health problems. And so in that sense, we have impact of UBI that is quite favorable, having again little, or maybe even no impact on employment, and positive impacts on health, including mental health, and also, in fact, positive impacts on education. And those positive impacts we see are concentrated among the most disadvantaged youth. And interestingly, we also see some impacts on civic participation. So basically, well-being is increased. And on top of that, we allow these people to be a bigger part of our democracy. So there's a lot of positive impacts from a program like that.
Well, that's a wrap. We got to do this, folks. So no, I'm just kidding. Aisha, no, but seriously, that is a lot of compelling data to show positive outcomes. And Aisha, I want to turn to you. I have had the pleasure and privilege of covering the Magnolia Mothers Trust. And I know that you're going on 2 years now, right?
We launch our third year next month.
Wow. And I know you collected a lot of both quantitative and qualitative data, a lot of stories. Can you share some of both of what you are seeing mothers experience with this extra $1,000 a month?
Yeah, no, definitely. So all of our data really bears to the reality of what we just heard as it relates to the data. Individuals continue to work, individuals move up to higher levels of employment, individuals pay off debt, individuals are able to show up more in their own lives. And the reality is so much of the lack of understanding on how individuals view guaranteed income or cash without restrictions, that's really steeped in stereotypes. And that's really steeped in a narrative that's not accurate. And, we can have conversations about where their narrative comes from and whether or not it's steeped in racism or sexism and both. And I would definitely say probably both. But what we are seeing is that the guaranteed income is allowing mothers to save, it's allowing mothers to have dignity, and also it's allowing mothers an opportunity for joy and to dream. And that piece of the equation is rarely what we talk about when we talk about guaranteed income and the power of cash. We talk so much about the consumer sovereignty aspect of cash and how you're able to participate more in the purchase power and spending money and paying off debt and those pieces. But the ability to actually dream and think about what it is that you want to do for yourself and your families and have the resources to put those dreams into effect, that has been life-changing. And that has a generational generational impact. And so, like I said, we've been doing this work now since 2018. We started with 20 women. We went to 110. We're launching our next cohort next month with at least another 110 women, really focusing on two pieces, continuing to provide the resources that families need, the financial resources that families need to participate in their lives the way that they want to. But also the piece that we're most excited about right now is really that narrative piece, because I do believe that the way that we go about changing policies and getting to where guaranteed income is the federal norm is by narrative and by policies. And one of my good friends, Ann Price at Insight, always says that policy only ever moves at the speed of narrative. And so we have got to get to the place where we are changing the narrative. And in order to do that, we've got to change the narrator and really start telling more powerful stories about how families who are receiving these guaranteed incomes and receiving these cash without restrictions are able to show up and participate in their own lives. One of our moms last year, who was in our first cohort, called me right before the pandemic hit, and she was happy. I had known this mom for over 7 years, and happy was not the adjective that I would use to describe her. And she was happy. And, she talked about being happy because for the first time she had hope. And for the first time she saw the possibilities for a life beyond affordable housing. And she used her participation as the Magnolia Mothers Trust as the launch pad to the next part. She had not worked in over a decade. She went and she got a job working at a restaurant, a cafeteria style restaurant, because of the fact that for the first time she had hope in her future. And that's really what so much of a guaranteed income is as well. It's not just about the cash, it's also the hope and the dignity and the way it allows families to show up.
That's great. And I couldn't agree with you more than I do about the narrative change. And I just want to commend you for the story collection you do. And I think that needs to be a model for how we see how things can help people. So thank you for that. Hope, since the Eastern Band of Cherokee Indians became a gaming tribe in 1996, dividends have grown from a very small amount, I think, at the beginning, to $12,000 annually for approximately 16,000 tribe members, and I believe a sizable trust fund for minors as well. What are you seeing in terms of how people are able to leverage those resources and any impacts on the community as a whole?
Yeah, I mean, that kind of money you just talked about is huge, and it has completely changed our community. And I think one of the great things that our tribe did was they didn't just hand out money, but we also invested in some of the institutions that were there to help folks. So now we have community members who have this additional income, and they have resources where they can go and they can find out how to improve on their life and how to make their life a little bit better. And one of those is through the work that I do, the formation of Sequoyah Fund. It came hand in hand with the start of Per Capita. And it was there so that people could take this money and leverage it for loans to start small businesses, to redo their homes. We don't do mortgages, but we take old houses that were built in the 40s and 50s through government programs and help them fix their leaky roof, put a porch on so their kids can play outside. Those kind of things are really important. And a lot of people don't realize sometimes that those options are out there, that they can do these things. They can start businesses. They can make their homes better for their families. And I think we really see several different uses of this money. We have the people who, this is the money that puts food on their table. This is how they feed their children. It is very important in their day-to-day lives. And then we have some folks who they're able to use this money to maybe pay up their electric bill for 6 months at a time. It really takes some of the burden of day-to-day life off of them so they can focus on other things. And then you have folks who say, okay, this is some extra money. I'm going to make a huge investment. I am going to open a business. I am going to take a lease out and I'm going to start a coffee shop. And those are the kind of things we are seeing. Prior to our casino and these per cap payments, our community didn't have a coffee shop, which is kind of an instrumental gathering place in a community. And with these and with institutions like Sequoyah Fund, we had a young woman. She was in her late 20s, and she came and said, I want to open a coffee shop. And we were able to fund that. And I think stories like that are a great success as to how people at different ages, different races, and different genders can really get ahead when maybe they haven't been told all their lives that those things are possible. So it's been life-changing for us.
Yeah, and it sounds like a big part of, or at least a piece of your work is, and it's similar to what Aisha was saying before, when people have the space to start imagining and planning. I mean, you've said that people this wasn't on their radar at all, the kinds of things they could do beyond just getting by is part of your experience, right, Hope? And talking to, even in classrooms, you're talking to young people about the possibilities now, right?
Oh, yeah, absolutely. I mean, we truly believe this kind of knowledge is important to start from an early age. So I'm doing math exams with 5-year-olds, with kindergartners. It's great. It's at our language immersion school. So we're teaching these kids the traditional values of saving. Hey, our ancestors used to harvest and save for the winter. Your money is how you are saving for the future. It's a cultural aspect of who we are as a people. And this is important for us to remember and to learn, and then to spread to our children. Our tribe is starting as early as 4th grade with their minors trust education, really getting that education out there, because we feel like the money is just one piece. The education and the knowledge of the opportunities is the other piece of how to use it in the best way possible. Thanks,
Hope. And Hope's in the mountains of North Carolina, so she faded out a second, but she stayed with us, so that's good. And by the way, the panelists should feel free to jump in if they have thoughts they want to share or building off of anything anyone says. I want to turn to Iona here and then get at all of your reactions. There are obviously different ways to go about how to do a guaranteed income program. So, for example, Magnolia Mothers do a monthly check. The Eastern Band of Cherokee Indians, it's 2 lump sum checks. There's universal programs. There are more targeted programs. Iona, what does the data tell us about the way we should structure?
So regarding, how frequent the payments should be, we have some evidence there, but, it's just that there are trade-offs. In some ways, it's better to have like a yearly payment, let's say, and in some other ways, it's better to have a monthly payment. And the reason is if you have, say, a yearly payment, which would be bigger, that can allow people to make an investment, like, maybe that's part of the money to buy a new car or something like that. So that's very helpful that they get a bigger amount. But on the other hand, by getting money to people monthly, that allows them to always have something that they can count upon. So should they find themselves in some dire straits, they can count on some money that's going to arrive soon rather than, in a whole year. And it's a little bit about how you can a little bit balance those two considerations, and perhaps having a monthly payment and maybe some education, like Hope was saying, that encourages people, if you want to make an investment in an asset, try to save. This is how you can do it. And therefore, they would also be able to make that investment. But so basically, those are the trade-offs with that. And then regarding universality, strictly speaking, if you say universal basic income, it literally means, you give the same amount to everybody. And that's one model. But, you have to realize that even if that's the case, once you think about the financing side, so you have everybody gets the same amount, but of course we have to pay for this program. And any proposal that's been made out there is a proposal where higher income people would pay more, even if it's through, let's say, a sales tax, because they consume more. Their 10% sales tax, for example, of a much bigger consumption just ends up being a lot more money than people who consume less. And so therefore, the Bill Gates of the world, would be paying a lot more into this program than, the money that they'd be receiving. So in any case, even if it's the same to everyone, it's still redistributive because of the way that we finance it. And, you can make it even very redistributive. If you have a tax system that relies very heavily on high incomes, then it can be extremely redistributive. So that's sort of one way to look at it. And an argument for doing it like this is that, if you one issue with just giving it to lower income people is the issue of how are you then going to phase out, we call it. So, like as you become higher income, do you suddenly lose it, or like what happens to you there? So that's sort of the potentially nice thing about saying, well, you get to keep it, no matter what. Maybe then you also have to pay higher taxes, as we said, because we all have to chip in for the system, but you're not getting your benefit taken away from you. So, there's all sorts of consideration, and then targeting can also have its advantages. And, perhaps Aisha, wants to speak to that.
Well, that's actually where I was going. I mean, obviously, the Magnolia Mothers Trust has a targeted approach. And Aisha, I why are you laughing so? Aisha, anyway, yes, I would like to hear your thoughts on the targeted versus the universal.
Yeah, no, definitely. So a couple of pieces with that. So we do $1,000 a month rather than a lump sum. When we were designing our project back in 2017, we really worked with our mothers in designing what the program should look like. So I run an organization, Springboard to Opportunities, that's radically resident driven. So we don't do anything in isolation without feedback from our families. So when we were thinking about what the program design should look like, we were going back and forth between the lump sum or the monthly or the quarterly or what it should look like. And we landed on the lump sum we landed on the monthly because our mothers talked about the ability to know that they would have the money every month to address those little foxes that come up. So the little foxes are, my child needs $25 for the science fair, or I need to get a uniform for my job, or, I need to get my car repaired, whatever that is. So having the income to address those pieces. And we've seen with our data that this income is definitely addressing the little foxes, because historically families would have to turn to predatory lenders in order to get those little foxes addressed. Because when you live in poverty, the reality is everyone you know lives in poverty. So you have no one that you can go to borrow money from whenever something comes up. So you end up going to these predatory services. And we've seen a 90% reduction in our mothers using those services with the Magnolia Mothers Trust. But not only that, on average, each year collectively, the women are paying back, not this year. COVID is neither here nor there. But last year with our data, women collectively paid back over $10,000 worth of predatory debt to those services. So we're seeing that by providing the monthly money, it is definitely having a direct impact. So as far as, us taking a targeted approach, I'm very clear when I talk about our work that I don't use universal basic income. It's guaranteed income. It's money that you are going to get on the 15th of every month, $1,000 for a set amount of time. And it specifically targets extremely low income Black mothers that live in federally subsidized affordable housing. When we started this work in 2017, we were like, okay, what are we trying to do? We're trying to do two things. We're trying to make sure that these mamas who need money get money. And we're also trying to have conversations about our social safety net and how the system in its design and the flaws within its design are making it virtually impossible for a subset of our population to matriculate out of the social safety net. And it's pretty much penalizing families and making it so where they have generational poverty. And so for us to have those conversations and for us to push the needle on that, we needed to be targeted in our approach. And so we said, all right, we're going to support Black mamas. Black mothers make 61% of what white men make in Mississippi. Our minimum wage is still $7.25. 1 in 4 Black mothers and their children live in poverty. So when we're having conversations about how to advance the country, we have to center our efforts first on those who have been most intentionally penalized by the way the system exists. Janelle Jones now remarkably calls that Black woman best. I did not know Black women best as a terminology in 2017. I wish I did, but she's building an entire economic framework about why we should be investing economically in the well-being of Black women in order to support the entire country.
That's great, Aisha. Thank you. And Hope, in terms of the way your program is structured, I don't know if you want to talk about I know you guys do the 2 payments. For a while, you did loans to help sort of in the times between, but you're not currently doing that. Talk about that experience a little bit for your program.
Yeah. So, and since we're per capita, our payments are almost dividends on the success of this. So there's a little bit of caution there with the government of you never know what the dividend is going to be. Of course, it's gaming, so it's a great industry, right? The dividends trend up, but when a pandemic hits and closes your casino, then all of a sudden it's, oh my gosh, what are we going to do? So we recognized the need that folks had in between these 6-month payments. And we recognized that a lot of people probably weren't getting the most out of their huge lump sums. They weren't doing the things that maybe could help really advance them. Round about March or November, things started getting pretty tight in households. So we started this program. We called it a per cap loan. You were really borrowing from yourself. So you could apply to get $500 a month, and it would be subtracted from your next distribution. And those were extremely popular with the community. And I think it was really helping people use their per capita a little bit more towards their advancement of their lifestyles and helping out in their households. But because of COVID, we had to stop. We weren't sure that the gaming dividends were going to be enough to cover those payments, and we didn't want people to over exceed their amount. I don't think it's going to start back up though, because it's a huge amount of work for the government to cut those checks every month for 16,000 people. That's the size of our tribe. And so it's much easier to wait and do the 2 lump sum payments. So really now we're kind of shifting our focus to how can we do budgeting and training around those 2 lump sum payments to kind of give people the tools to maybe give themselves the $500 a month. Let's put it in a savings account. Let's put it aside and try to make the money work for you without the government coming in and trying to do that for you. And it's challenging. And I think it'll be interesting to see how it works as these loans kind of become a thing of the past. They may come back up. You never know who's going to get elected. And that kind of thing can be used as a political tool. But yeah, the time constraints were pretty strong with those individual checks.
Yes. Yeah, I hear you.
And if I may jump in, right, the dividend for Hope's tribe is the same for everybody, right?
Yeah. So you receive the same amount regardless of your income level, so I mean, we still do this totally antiquated thing called blood quantum, where we know what percentage Native American we are, which is a whole other topic, but everyone gets the same. If you're 100% Cherokee or you're 20% Cherokee, which is good. So, so yes, everyone is an equal share, and that's very cultural appropriate. We are a culture that everyone is equal and you take care of each other. So it is assumed that if you are doing better than your neighbor, you will help your neighbor out.
Right. And I also wanted to say that obviously, if you don't have the ability to raise taxes and you just have limited funds, it only, is so very sensible to focus on those who are most in need. So, for a sort of project that is a bit of a particular project, then it makes a lot of sense. But if we're going to, put this to scale to an overall project, then that raises the issue of, again, like what happens if somebody, like Hope was saying, this woman who started a coffee shop, maybe before that she didn't have a lot of income, but if she's successful, her income is going to go up. And if we say that the income is just for those who are low income, does that mean that now she's going to lose her guaranteed income? Or, how are we to think about this? So I think that's something that it's important to, even if you want to make it targeted, kind of think about the issues around, again, like if people do manage to better themselves and are no longer poor, what happens to their benefit? And, because if you take it away from them, it's sort of punitive in a way that, they're doing better and now they're getting less benefits. So that's just something to consider, even if you want to do it targeted.
But I think if you can, if doing it targeted and with guaranteed approach, totally different than what Hope and Hers, it's for the individuals within her community. But if you are just upfront with individuals about the fact that this is time limited, that it's not something that goes on in perpetuity, like with our work, families know you have a year. So they really do look, we have a lottery is how we select families, and they actually really do look at it as winning the lottery. And having that understanding of you have a year to take this opportunity and do whatever you want to with it, that transparency and that honesty and that ability to plan, they really appreciate, because for so many of the families that we work with, they don't get that level of transparency as it relates to their income or their benefits, because everything is so fluid.
That's great. And we have about 5 minutes. And although I had more questions, I want to skip to my favorite question, which is there anything I've not asked you guys about that you are passionate about when it comes to this topic of guaranteed income and economic security? This is the freebie. This is where, man, people really need to know X, Y, and Z. So does that strike a chord with any of you? Does anyone want to lead off? Otherwise, I can go to my other questions, but I like the freebie.
I like freebies. Everybody needs a freebie these days. I think the part of my work that I never talk about enough is that we are not just supporting our moms with the guaranteed income for a year. We really are taking a full family approach, and we are opening children's savings accounts for their kids and seeding those accounts with resources, because we really are trying to figure out how do we create and support wealth or income for the entire family over the long haul. And I think the other piece that we don't talk about, or I don't talk about enough with our work, is really all of the other supports that we have available for the families that we work with. Cash is not the balm for all of the ailments that exist when you live in extreme poverty. If it were, hopefully, we would fix it. But there are so many other pieces of the equation that we have to think about. We have to talk about trauma. We have to think about community building. We have to talk about advocacy. There are all of these layers of the puzzle that we also provide that, I don't talk about enough, because we want to talk about the sexy part of cash. But, for us in doing this work well, the money is a big part of it, but it's really a small part of what it is that we're doing and how we're investing in our families. So.
Great. Thank you, Aisha. Hope, Iona, freebie.
Yeah. Well, so I love what you just said, Aisha, because I think we have a kind of a thought in our process, in our community, where if you do much better than everyone else, you're almost kind of thought of as that you think you're too good or you're better than the community. And so there's this feeling of everyone needs to stay on the same level. And I think that scares a lot of people. And I love, though, the idea that people can transcend that and everyone can rise up above that and really just working together to make, everyone's lives better is so nice. And so whenever you're doing things like starting a business, you're helping your community as a whole. Yes, if you are successful, you are probably going to increase your income, but you're also employing community members and you're providing a good or a service to your community. And I think those things are so important in community building. Like Aisha said, I think that is so important in this work is building that group and that harmony together.
Thank you.
Well, yeah, I wanted to just jump in to say that this is also relevant to the debates about the stimulus check going forward, and that there's been a lot of concern that, it's not targeted enough, therefore it's too expensive because we're giving it to people who don't need it, and so on and so forth. And, I'm hearing those concerns because not everybody lost income, and lower income people actually lost a lot more income in this crisis than high income people. But at the same time, it is also the case that a lot of people need support. And the advantage of cash is that nobody's left behind, since everybody's getting it. And by the way, with the stimulus checks, the very top highest income people aren't getting it. So it's sort of like the middle class and below. So basically with that, we make sure that everybody gets their needs covered no matter what. And if you're really concerned that some people don't need it, that's where I'm coming back to my taxes. It is always possible to tax it away next year, as you're paying next year's taxes. If it turned out you had really high income, including that income, you can perfectly chip in. And so that would make a lot of sense in that way. So, and also people are really concerned that this is going to increase prices because there's so much money in the economy. And I just don't think that this is a major concern right now because we've had very little price increase. In fact, too little compared to what the Federal Reserve wants. So even if prices did increase a little bit, it would rather be a good thing. So I feel like all the fears and the naysaying about Biden's plan and the idea of including more stimulus payments are mostly misplaced.
That is perfect timing because we literally just ran out of time. And so I want to thank all three of you for joining us today. And also, audience, I told you they were awesome, so I know you woke up for it. And we look forward to answering questions now. Thank you.